As a family medicine practitioner in the clinic, having the conversations with individuals that come in, I see a lot of minority patients. And so African Americans have lots of questions on, will this be, are we looking at a situation that we've seen in the past, whether that be the Tuskegee trials or any other episodes where minorities have been wronged or harmed in some way as we've learned about medicine? And I'm telling them that this is not the same thing. So I think that for us, it is an opportunity to acknowledge that there have been times in medicine we have not been good to minorities, whether it be women, people of color. But in this case, as we're battling the pandemic, I want to let patients of color, women, know that this vaccine is not set to harm anyone. We really are trying to protect a global population. So, we want to acknowledge that things have happened, but this is not the same thing. This vaccine has been studied in a large group. And while there's always concerns, how many minorities, were there a lot of Black people in there? Were a lot of people of color? Were there a lot of Latino people? And we're always working to improve participation in research and people of color. But even in this case, there's been nothing to date that says that people of color should be hesitant to get it. If anything, I'm encouraging people of color to get the vaccine, because as we talk to other Black doctors in the United States, we're looking at our states and our graphs. We know that minorities are dying at a higher rate of complications from COVID or the infection itself. And we also know that in those same communities where people are dying, we're seeing less enthusiasm about the vaccine. And so we've got to find ways to encourage each other, educate each other. And we know that's going to take tolerance and patience and lots of education. We're signed up for it. And I just want everyone to know that people of color should be just as enthusiastic as getting the vaccine to protect themselves. And they should not have to consider that their color may play a role in how we care for them for COVID-19. In my clinic, similar to Dr. Revia, we're seeing a lot of long-term sequelae to COVID-19. So, probably since March, when people were first coming in to say, I have been infected, we were testing people. I have some patients that were positive in March that I still am treating for shortness of breath, memory loss. I've put 30-year-olds on oxygen because they were still hypoxic. And so, one of the things I hear a lot of people say is that, well, we've been in this pandemic all this time and I haven't gotten infected yet. Or if I did get it, didn't seem to do anything. So maybe I'm okay. And I just want people to understand there's more to this to consider. Okay, I was infected, but did I die? Like, it's not a yes or no thing. There are lots of things in between that we're actively learning. And similar to what Dr. Revia said, that we don't really know exactly what the progression is going to be, if they're going to fully recover, or what therapies we can give them. We're trying things based on what we know about medicine, what we basically know about when your lungs aren't working, or when your memory has failed, or when your kidneys aren't functioning. But I am seeing a lot of people who are very healthy, who became sick with COVID, who thought they were going to fully recover, and they are not recovered yet. And I do not think that all of the FMLA forms, all of the short-term disability forms, all of the albuterol and codeine and Tylenol and ibuprofen that we're giving you makes you whole. And that is what people want. And as a family medicine doctor, that is what we're thinking about. How do we get you back to your previous baseline and make you whole? And that has become very complicated. And we're seeing more and more cases where the answer to that is we're not sure or not yet. And when we can get you back, we do not know. That I know, like, particularly in African-American communities, like, big celebrations are a big deal. I, have watched on Facebook and Instagram, talked to friends and families where everybody's trying to navigate how we do these big parties. And, the first answer is, let's not do them right now. Okay, that's the first answer. Like, can we not celebrate to the max at this very moment? But one of the things that I wanted to talk about is that there seems to be this idea that you can be nervous and skeptical and still get your vaccine. and they don't have to be conflicting. So, in medicine, when you go through training, whether that be a medical student or a resident or ongoing learning, as an attending physician, skepticism is a part of the name of the game. It's how we learn, right? To be inquisitive and be suspicious makes us open up the text. It makes us read articles. It makes us want to learn more. So we are very comfortable in the idea that people are unsure or you need more information. Now, we do that drives our learning in medicine. For the general population, what I don't want that to do is then drive your decision to say, I feel uneasy, this feels new, so then I will not get it. And in a lot of Black communities, that's what's happening. Like, I don't know about this. So maybe since it doesn't feel right in my spirit, maybe the Lord is telling me no. That is not it. Okay. You can be nervous. You can be feeling like you need more questions answered, but it's still okay to have all that happen and still say, but I am going to get this vaccine because I know it's going to protect me. It's going to protect the people in my home, and it's going to protect the people in my community. And so it's one of the things that I've been having a lot of conversations this week alone in the clinic to say, but I feel so nervous. Can I still get it? And the answers have been yes. And we've been going through all the question and answering with every individual that's been in my office. And I think, are getting more and more people to feel comfortable with the idea that you can still protect yourself, even as you're trying to learn more.
All right. Well, there's also, we wanted to mention about the fact that the infection rate and mortality is higher in the African American and Latino communities. Can you talk about that for a sec?
Absolutely. So, in African American and Latino communities, we've got high comorbidities. So we come through the door kind of at a deficit. So before, January, we were already like in the trenches discussing diabetes and hypertension, morbid obesity, COPD, emphysema. We were trying to fix tobacco issues, trying to decrease drinking, trying to improve eating habits, trying to find ways to get, people to exercise in their communities where sometimes, depending on where you live, you don't have access to good gyms, good foods. We were talking about food deserts. All those things were existing before we got here. And so a lot of people, will talk about the fact that the COVID-19 infection, the COVID-19 syndrome further exposed the deficiencies in these communities and further exposed the fact that we were already having a hard time keeping people very healthy. Now that we're in a pandemic, we are seeing higher rates because if people are already sick at baseline and then they get exposed because they have to work, they have to get groceries, or someone in the house has to do those things, we're seeing increased morbidity and mortality. And so, that's the reality of what it is. It, puts more on our place to say, how do we fix both? And we're working hard to do that. But that is a reality. We are dying at higher rates for lots of reasons. And it means that we also need to push these communities to say, tell me what you need from me to help me protect you. What do you need me to answer? What information do you need? Tell me how to make you comfortable so that we can get you what you need to keep you safe, because we were already working hard on safety issues from the beginning due to comorbidities.